Other iris signs, contraction furrows. Contraction furrows are circular grooves that form arcs or complete circular furrows around the iris. They can be in both the nutritive zone and the ciliary zone. Contraction furrows occur in the iris over generations of time and are genetic. They are affected by the posterior membrane that will have wavy areas causing the iris fibers to buckle in grooves or ditch-like formations. Contraction furrows will appear deeper when the pupil is expanded. The areas of the iris that these furrows are located in and the shape of the furrows have proven to be important to the health of an individual. Let's review specific types of contraction furrows. Now we're going to discuss contraction furrows. We can see contraction furrows, we've discussed them before, they're grooves that go around the iris. And now we're going to discuss specific types of contraction furrows and what they mean to a person's health. The first type of contraction furrows that we're going to discuss are called concentric furrows. And these furrows are even furrows that go around the iris. They are evenly spaced. They are not broken or intersecting. People who have concentric furrows in their irises can have a mild degree of spasms or cramping. They have sometimes distress or anxiety. They can suffer from anxiety, mental restlessness, and have problems with absorbing minerals. Humeral furrows are always in the humeral zone, which is zone number 3 outside of the collarette. These humeral furrows are furrows that run through that humeral zone, and these people tend to have circulatory restrictions of the blood and lymph. So anytime you see a contraction furrow anywhere in the humeral zone, ask questions about circulation. Do you have cold hands and feet or numbness or tingling? Intersecting furrows. These furrows crisscross. They are intersecting with each other. And when we see these intersecting furrows, these people tend to have a family history of nervous disorders, spasmodic conditions. There could be some anxious, psychosomatic type tendencies. If the furrows intersect in the cranial region, such as up here in the head area, these people tend to have headaches or migraine headaches. Peripheral furrows go around the outer part of the iris, the outer part of the ciliary zone, and they can be in zones 5 or 6 or 7. And these furrows have to do with circulation of the lymph or the blood. There can be cold hands and feet. They have often difficulties with skin congestion and poor elimination through the skin. They may have aching in their joints. They can have a low resistance to infection because the lymph has a lot to do with the immune system, and wandering rheumatic pains. Sectoral opening of furrows. This is when the furrows break in certain areas. And when they break, you want to ask questions about that part of the body. For example, here at 3 o'clock in the left iris, there's a lack of energy to the lung area, possibly the heart. Here there's a lack of energy to the bronchus area. So wherever they break, you want to ask questions. That's a lack of nerve energy. There could be muscular tension, pain, or spasms in those areas. And it could be related to the spine as well. And remember, we discussed the pupil, so if they break adjacent to the thoracic spine, they could have pain in that part of the spine as well. Sloped furrows. When the furrows come down and slope, that has to do with tendencies for seizures, a possible family history of epilepsy. And in the head area, also you could ask about headaches or dizziness, fainting spells, things like that. For sure, they need extra magnesium when you see this. Stair-step furrows. These are when furrows come around and go up in a stair-step type fashion. So here they're going up in a step here, here, and here, almost like stair steps. There's several furrows beside of each other. This is another family history of seizures or epilepsy when these types of furrows are found in the cranial segment of the iris, which is up here. They could have migraines, inner ear disorders, dizziness, poor circulation to the head and brain.